So this is PAILs and rails for elbow pronation. This exercise is good for anyone who has really tight forearms but doesn't respond very well to stretches, or for anyone who suffers from tennis or golfer's elbow. Okay, so what you're gonna need here is a dowel and preferably a bench that you can anchor your elbows on. And from here, you're gonna go into your end range of pronation. Pronation meaning that you're rotating your forearm so the palms are facing down towards the ground. You're gonna grab the dowel with an overhand grip. This is gonna bring you into pronation. Then you're gonna take your other hand and you're gonna give yourself a little bit of overpressure to bring yourself into a deeper stretch. And you're gonna hold this for about 90 seconds to 2 minutes. After your 2 minutes is up, you're going to shift to your PAILs contraction. This is where you're going to try and supinate the forearm doing this action, but you're going to use your other hand to block that from happening. From here, you're going to go into your PAILs contraction. You're going to ramp up starting at 20% of your effort, and then 40, then 60, 80, all the way to 100. Or your safest maximum effort. You're trying to get as much supination as you can, but this hand is blocking that from happening. And then you're gonna hold this contraction for about 10 to 15 seconds. After 15 seconds, you're gonna slowly ramp that intensity down, bringing the dial back down to 0 and seeing if you've gotten a little bit more range of motion. Then from here, you're gonna go into your rails contraction. So you're gonna try and wring out more pronation. So now the dowel is going down towards the floor. So you're actively trying to pronate as much as you can. Try to avoid compensating in your body or in your shoulder by leaning and trying to cheat. You can do this 2 to 3 times a week on alternating days. So some things to keep in mind, if you are someone who's suffering from golfer's or tennis elbow, then ramping up to 100% effort on your PAILs contraction might be a little bit aggressive for the tendons. So what I would recommend is probably starting with a low level of intensity and maybe just ramping up from 20 to 40%. And then over time, as the tissue starts to heal and adapt, you can gradually increase that intensity to your safest effort.